President-elect Pankaj Muntreja, outgoing President Anil Goel. Sorry, Anil is never outgoing. Anil is always working, maybe here or there. Dr. Vinay Agarwal, past National President. Dr. K.K. Agarwal, Secretary General, IMA, other dignitaries, doctors who have come from Kerala, Chennai, Dr. Pillai, and all other doctors present over here. I am very much delighted today to be part of the assembly of persons who are considered in the society next to God. A society, an assembly of Devtas. I am very much obliged. This is the most respectable profession in the world. It has both the things included in their job. They work as well as they work for the society also. There is a saying in Punjabi, "Nale full te nale faliyan." They are doing both the things. They are serving the society. And I am very clear in my vision that the medical health being provided in the nation today is very much dependent on the private sector. Though it is the primary responsibility of any social welfare government to give two things to every citizen of its nation. One is education and second is health. But it is also true that in the past 68 years, we have spent millions of rupees from our exchequer, from our budget, on both these sectors. But yet till today, poorest of the poorest man does not want to send his son to his children to the government schools, and poorest of the poorest child does not want to get his parents treated, cured from a government hospital. Had the private sector not shouldered the responsibility, it can be very well imagined what would have been the situation of our country today. I salute you all that you have been doing a great service to our state, to the nation. It is also true, and speakers after speakers have mentioned many problems, many difficulties, many things. And most of the speakers have mentioned about the PCPNDT Act. We are very well aware that the sex ratio in some parts of the country to an alarming situation. And our state, Haryana Pradesh, Haryana state, is the most affected state in the country. If we go anywhere outside Haryana, people recognize us as leaders from the state where females are buried, females are killed before they come to this world. Our Honorable Prime Minister, he started a mission from this very land, from this Panipat, last year, on 21st January, so that this blood spot on the face of people of the Haryana is removed. It is right, and I agree to this, that barely on the basis of some documentation, nobody should be punished. No case should be registered only because there is some column left blank in the F form. I am concerned about this. And I have instructed my department to solve this problem. To solve this problem. I have instructed them to prepare a website, an online F form, and make it mandatory for all the ultrasound people, so that no form will be left blank. And if it is left blank, he will not proceed further. We will solve this. But at the same time, this is also truth. And we should boldly accept this. That near about 25,000 girl childs does not see the light of the day in our state. Maybe some quacks are indulging. Maybe some few people are doing this business, spoiling the image of the entire fraternity of the doctors. We should look into, and as a responsible Indian Medical Association, we should tell them, you stop this practice. It is tarnishing the image of the entire doctor family. Most of the doctors are doing their job very nicely. They are doing whatever can they do for the society. But when even a single case is published in the newspaper, or something like that comes on a TV channel, the image is tarnished. We should take this project. We should own this responsibility. You can do it. You know better. So that the status of a doctor, which should be in the society, it should grow further. It should grow further. And it should be in such a high spirit that when a doctor enters any assembly of people, everybody stands and welcome that a doctor has come. That is doctor has come. Government and you, government and IMA, jointly can solve this problem. They should work jointly. I was very much pleased when you announced that you have removed some of your doctors from the IMA membership when they were found involved, indulged in this PCP and DT Act. We will sit together. We will solve the problems, and I, as an health minister, rather a responsible health minister of the state, I can show that no innocent person will be touched by the authorities in this regard. I can assure you all.
Thank you very much.
I can assure you, we have to work collectively, because this is not somebody's individual problem. This is a state's problem. This is a national problem. National problem. We are equally responsible that this tag, that this black spot is removed from our face. We should work collectively. As far as you are mentioned, implementation of the Clinical Establishment Act, I have gone through that act. And I don't want that by implementation of the act, some inspector law should come in the state. I don't want that at all. Though some PIL is pending in the High Court regarding implementation of this act. Maybe someday High Court direct us that this act should be implemented in the state. But I can guarantee you, I can ensure you, and rather I have already written many times to the IMA that they should come and consult, so that all the clauses which can become tools in the hand of the inspectors, they are removed. They are removed. When they came to meet me to invite in this function, at that time I also requested them to spare some time, so that government officials and the IMA sit together and make it, if it has to be implemented. I am saying, if this has to be implemented, it will be implemented with your suggestions. With your suggestions. We have hosted the proposed act, not proposed act because act was passed by the previous government, Bhupinder Singh Hooda government. The proposed rules We have hosted on our government website. Anybody can suggest that this thing should not be included and this should be included. Anybody can give the suggestions, and we are open to all your suggestions. I welcome your suggestions. It has been kept in abeyance because you did not have the time. Only for this, because I have given noting on the file. I have given my noting on the file that it should be introduced after it has been discussed with the IMA Haryana. I have given clear-cut instructions to my department. So, I was told that you have collected some suggestions. Though you have put up some resolutions, those don't want that this should be implemented. But if High Court directs us, then we will have to implement it, and if it has to be implemented, you should spare some time to study these proposed rules and give your suggestions so that the amended rules are passed. There are some changes we have proposed in the Act also. The Act passed by the previous government has also some defects. We are also considering to amend those Act also. So, I again request the IMA that they should come to my office someday. I think we have already written a letter to them so that we come discuss and decide and make it the Act, Clinical Establishment Act, which watch both the interests of the patients as well as of the doctors and of the hospitals and of the institutes, of both. Because I am health minister of both I am not of only one. I am to watch the interest of both, of the patients as well as of the doctors and hospitals and institutions also. You have also referred some incidents happening against violence incidents happening against the doctors. Some incidents also occurred against our government doctors. Strong stand that nobody will be allowed to take law in their own hands. Nobody will be allowed. Some incident occurred at Jain. I stood by my doctors.
Very good.
You are aware of this. I stood by my doctors. If my doctor is at fault, you can tell us, we'll inquire and take the appropriate action. But you are nobody. You are nobody that you take law into your own hands and start punishing the most intelligent and most respectable professional of the society. You are nobody. I will not allow at any cost. We have taken some steps for our hospitals also. I was written to the DGP to provide security in all the hospitals. I have written to my DGH to install CCTV cameras in all the hospitals. Because we have to safeguard the interest of our doctors. And you, as you have referred that none of the Chonki in charge or SP knows about the Haryana Medical Violence Act. So, tomorrow, I'll write to all the SPs and send a copy of the act. And send a copy of the act that they should go through their act. And there should be no violation of the act in the state. I assure you, there will be no violation of the act in the state. We cannot, as a responsible government, we cannot permit anybody to play with the law, to take hands in there, to lie in their hands. And especially I am very strict regarding this matter. I am very strict regarding this matter. I am also happy that you have dedicated this year to diabetic blindness, retinopathy. It is very good. Most of the people are suffering from diabetes today. And lot of disease are attributed to this diabetes. Though government is also going to start some national program for the awareness of this diabetic from the next financial year. But I am very much pleased that as part of your social responsibility, you have adopted for diabetic retinopathy. You will make people aware about this, and you will also provide treatment whatsoever at your level. It can be done, given to, and I will ask my department, I'll tell my DGH and ACS Health that they should sit together with you, and whatever help government can provide in your project, we will work side by side with you. We will work side by side with you. I am also happy that Dr. K.K. Agarwal has given some suggestions that we form some working group. I, as a health minister of Haryana, announce here that that group has been formed.
Very good. Wonderful.
This group is formed. It is very nice that we come and sit together and solve the problems. We share the technology. We share the new introduced medicines. There are a lot of things. Technology is daily moving forward. I have proposed for my doctors in health that every doctor has to go for a refresher course. Every doctor has to, so that he's made aware. He's made aware of all the latest technologies, the latest medicines, and the latest way of treatment. And if you and we and you sit together, many problems will automatically be solved. Automatically will be solved. I am also thankful to Dr. Vinay Agarwal. He was kind enough to give suggestions to improve the medical structure of the state. Thank you, Dr. Vinay Agarwal. We are also trying. We have made a roadmap to improve the status of government medical health in the state. I may tell you that I am going to install MRI machine in every district. In 7 districts we have installed. I am going to install dialysis machines in every district very soon. Our hospitals will go online this year. All the data of the patients will be online in Haryana. First time in the country. All the data. Any doctors of Faridabad, if any patient from Kalka comes to him and tell him the unique ID, he can know what treatment he was given by the Kalka doctors, what medicines have reactions on him, and what antibiotics does not work on him, so that he does not try hit and trial method. He does not work on hit and trial method. And he don't start his treatment from the same point from where Kalka doctor has started. We are improving it, sir. We are improving. And we have also taken in hand a very important decision. I am working though that 84 hospitals of my state, government hospitals, 4 hospitals in each states, in each district, 1 district hospital, 1 subdivision hospital, 1 PHC, 1 CHC from a district. 84 hospitals will be NBH, got NBH accredited. 84 hospitals. My department is preparing all the estimates and all the changes we will have to do. We had some meetings with NABH team also. We are doing it. And I am aware that my PSCs are not doing well. We have shortage of doctors. Though we have, after coming to power, we have employed many doctors. There are about 350 doctors, 389 doctors we have given employment. But still we are short of doctors. For that I am also working. You see, as per WHO guideline, there must be 1 doctor for 1,000 persons. 1,000. But in our country, it is 1 doctor against 2,800 people. So for more doctors, we should have more medical colleges. More medical colleges. And I am working on that at least our state, every district of my states should have at least 1 medical college in the state. For that we are working. In 8 districts, we already have medical colleges, some private, some government medical colleges. In Bhiwani and Panchkula, we are going to upgrade our district hospitals to medical colleges. There is a scheme of the Government of India to upgrade district hospitals which have capacity of 300 beds. They can be upgraded. We have forwarded the case to the Government of India so that those we are able to build medical colleges. I have contacted some private people also. Recently I met Chief of Dera Sacha and I requested him that they should open 1 medical college in their district, and he agrees to it, that they will open medical college in Sirsa. There was 1 medical college, Miri Piri line, unbuilt for the last 10-15 years. Near about 200 crores have been spent on that, but due to some apathetic attitude of the previous government. The necessary permissions were not being given to them. I went to Amritsar, I talked to SGPC chairman, and I told them that to start the medical college and all the government hurdles will be removed within days, and I assured them that all problems will be removed, and I ordered the officers that all necessary certificates should be issued to them. We approach others. I have increased the seats of Adroha Medical College from 50 to 100. I have increased the seats from 50 to 100. And one medical college has been assured by the Agarwal community of Delhi at Bahadurgarh. We have laid the foundation stone of that medical college, and there a big medical college is coming. In the near coming days, I am going to approach other social and religious organizations as well as the corporate sector that they should come and they should make at least one medical college in the state, maybe in PPP mode, maybe in private mode, maybe it may be government, but we are determined, unless we don't have more medical college, there will be a shortage of doctors everywhere. There will be shortage. And at the same time, I am also trying to enhance the benefits being given to doctors in my government hospitals. So, sir, Dr. Vinay Agarwal, I am trying something. Not everything. This cannot be done by anybody. But at least I am trying to improve so that everybody in the state get affordable medical care. Everybody in the state, may be poor, may be rich. Nobody dies in his house because he cannot afford the medical treatment of the country. No person should die. No person should die. I am working on that. But it takes time. There are many difficulties, there are many problems, and you will be astonished to know that our state, which has been being propagated as Haryana #1, and crores of rupees have been spent by the previous government to advertise this slogan, Haryana #1. But in Haryana #1 state, only 2% of the budget was being spent on the health sector. I am trying to increase that the budget on the health sector is increased. Unless we don't increase the health sector, the budget on the health sector, we don't have the equipment, we don't have the doctors, we don't have the paramedical staff, and we raise slogans against the doctor, the doctor has done nothing. What will the doctor do when he don't have the equipment? What will he do? What will we do when he don't have the equipment? I have visited most of the hospitals and in the emergencies. I have found only one stethoscope which Dr. K.K. Agarwal is still having. One stethoscope, one BP apparatus, one thermometer, and at the most one ECG machine, a torch, and that somewhere there is no light also. No light also. Recently I have ordered for purchase of generator sets for almost 80 hospitals, that they should have generator sets. So unless we don't provide the equipment, what a soldier can do on the border if he don't have the weapons? He can't do nothing. And then we accuse that he did not discharge his duties. So, I am trying to equip my doctors. I have given an order of 64 crore rupees equipments so that my doctors are well equipped. And when my doctors are equipped, I am confident that my doctor will do its utmost to save each and every person. That too every doctor does. That too every doctor does. No doctor wants that any patient should go unattended or any patient should be wrongly treated. No doctor wants. No doctor wants. So, you and we are one. It is single IMA. My doctors are also your members. And we should work collectively. And collectively we will work. We will work for our state. We will work for our people. And we will be able to give affordable medical care to each and every person of the state. This should be our motive. This should be our aim. This should be our goal. This should be our goal. That every person is given the affordable medical care. I am thankful that you invited me in this gathering of the most elite persons of the society and most responsible community of the state. And I am hopeful that the responsibility which you have shouldered on the new IMA team, they will discharge their duties to the satisfaction of all the doctors of the state. Thank you very much.